So today I'm going to talk about some tips and show you some exercises for people who have osteoporosis. So the big thing to know with osteoporosis is if you have a compression fracture, it needs to be stable before you start doing any kind of stretches and exercises. So no matter what, you need to check with your doctor to make sure it's okay to start doing any kind of stretches and exercises, just to make sure that you don't end up irritating the situation. So with osteoporosis, a great thing to remember when you're doing exercises is to keep your spine in a neutral position. I'm going to show you some exercises lying down, and it's a great way to keep the spine in a neutral position to be in what we call hook lying, and that's basically just with your knees up. The reason that it's good to be in this position is when you bring your knees up, it helps flatten out your back. And when you're doing exercises, when you have osteoporosis, you want your spine to be in the most neutral position possible. A lot of times when you have that osteoporosis, especially if you have compression fractures, you start bending forward because those vertebrae start compressing or fracturing, and then you have that forward bend posture. So you really want to be able to get back into that upright posture and strengthen in that position so it stays in that position. So the first exercise is just going to be doing some shoulder flexion in this hook lying position. So all I'm doing is having my legs propped up, kind of keeping my knees and my hips in about the same position, really trying to flatten out my back to get it into a nice, comfortable, neutral position. And then just bring my arms up into flexion. So just coming up this way. Now, when I come up and back, if I have osteoporosis, I might have a little bit of that forward posture. So I really want to kind of push those shoulders down as I'm bringing my arms up. Now, I might only be able to come up to here if I have a lot of tightness and pain in the shoulders, and that's fine. Just go to what's tension, maybe slightly uncomfortable, but you don't want to force it. You really just want to slowly start getting those motions, but come all the way back down and then come up as far as you comfortably can. Now, these can be done for reps. You could do like 10 or 15, or you can do it for time, like how many I can comfortably do in 30 seconds. Just again, making sure that you're checking with your healthcare provider to know how many you should be comfortably doing. Then the next one is going to be going into my arms making a W position. So kind of almost like if you were thinking about your hands coming up into a stop sign position, or if you look ahead above, it's a W position. And so now I'm just coming up here and then really pushing back and trying to squeeze my shoulder blades together. So here, it's the motion of coming back down. I'm squeezing, I'm trying to get my arms flat. But again, if that's painful, if I've got those forward rolled shoulders, you just try and push the shoulders back as comfortably as you can, and then take those arms back just again to pressure, maybe a little bit of uncomfortableness, but you don't want to force it. Listen to your body. It's really important to listen to your body when you do these. So again, it can be done for time or it can be done for reps. So then the next one is going to be isometric hip extension going back. So even though I'm in this hook lying position where my hips are flexed a little bit, a lot of times with osteoporosis, you get that forward position and those hip flexors become tight. But you want to start strengthening them before you make big motions that might irritate the spine even more, because those hip flexors are connected to the spine. So I'm just going to do an isometric exercise, which is I'm activating the muscles, but I'm not doing the movement that's going to cause pain or might cause some irritation in there. So all I'm doing is taking my heel and pushing down into the couch, the bed, or if you're able to get on the floor, a lot of times a firmer surface is a little bit better, but I understand a lot of people aren't able to get down comfortably on the floor. So again, I'm just pushing down. I don't have to push down with everything I've got, because they might want to try and cramp on you. Those hamstrings might try and cramp a little bit. So I'm just pushing down and then holding it for about 3 to 5 seconds. You can do one at a time. So now I'm pushing down this way, or you can do them both at the same time if you want to. So I'm pushing down almost like I'm getting ready to go up into a bridge, but I'm not lifting anything up. So I'm just activating those muscles. Again, not as hard as you can, maybe even starting off with 20 to 30% and just see how you feel afterwards. But again, holding that for 3 to 5 seconds, you can do it again for time, or you can do it for reps. So then the next one is just going to be a pelvic tilt. A pelvic tilt is a great exercise, but a lot of times there's not a lot of movement, so sometimes it's hard to get that movement down. If you watch here where the pelvis is, it's just like it sounds. You're tilting the pelvis. This is going to be going into the posterior or going back position. And so really all I'm doing is just trying to flatten out my back. So you can see that little bit of a rotation there. It's not big, but it's almost like I'm trying to take my belly button and push it into the couch, the bed, or the floor, whatever I'm on. But I'm not using my feet. So you can see my feet are very comfortable. I'm not like pushing up into a bridge. I'm rotating everything back. I'm using those pelvic floor muscles to help strengthen those, to keep my back nice and strong, holding that for 3 to 5 seconds and then relaxing. So it's not a big movement, but it's really working those muscles down there a lot. And then the next one is just going to be marching while you're in this hook lying position. So again, it's just kind of like it sounds, but go slow and controlled with intention. You're not just, marching back and forth. Make sure that your spine is in that nice neutral position. If you need to kind of push the shoulders down a little bit, and then I'm just going to bring one knee up, nice and slow, come back down, bring the other one up, and come back down. So I like to alternate with this one just because you're kind of getting that reciprocal motion. You're giving the other side just a little bit of a break. If you want to do, 5 or so just on one side, you can, but I really like alternating back and forth. So these are some nice simple exercises to start with: lying down, getting in that hook lying position to make sure that your spine's in a nice neutral position. But again, make sure you're getting cleared by your doctor, because if you happen to have a compression fracture, it needs to be stable, and you really need to make sure that you're doing what you're supposed to be doing. So if you'd like to help support my channel, click on the link up there, and don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.